So just before we're doing the forearms, let's think about deep tissue as an approach. Yeah. So can you do anything with a hold that might be deeper tissue? Yeah. You can just lean onto. Yeah. Maybe not at the beginning. Maybe it would take some time to build it, but you can do it slightly deeper. Good. Then, by the way, in the internal assessment, I saw that some of you bring in the towel from here. So try really to come and glide it. Yeah. Now, what about the amount of oil? Are you going to use a lot more oil or a lot less?
Less.
A lot less. Good. So you need a lot less oil for the deep tissue because you don't want to glide too much. Yeah? Okay. Is there any effleurage that you can do as a deep tissue? Absolutely, yeah. You take both hands and you just lean. How's the pressure? Good. Good. So you lean into the table. Now I tell you a secret. How do you know that you're leaning onto the table? Because if you look down and you see your eyes above their spine, that's when you know that you're leaning. If you think you're leaning here, you're not doing anything. Yeah? And I see in some of the videos on YouTube that people leaning from here, they can't do any deep tissue from here. And that's kind of what I told you about the deep tissue. You know, it's not deep tissue, it's effleurage really. So really lean onto. And if you want to do even more, you can lean with the forearm this way. Yeah? And just observe that you're on really 100% of the spine. Yeah? Don't bend your back, but launch your back leg. Yeah? So instead of having a short distance between your legs, just be sure that you have more distance. So you can do that with the effleurage this way, the other way. Now, when you put the weight, be sure that it's on the edge of the fingers, not here. Here's going to be, actually you can do it here, because then the base of the wrist would be taking the most of the pressure. Good. Let's talk about Petrissage as a deeper tissue. Right? So, yeah, base of the wrist. Yeah, you just have to put more kind of weight onto here. Yeah? If you collapsing, then I would suggest look away. You have to look with your hands. Now, for example, I feel that there is a bit too much oil. Any suggestion what I should do?
Bring the towel.
Yeah? All I do is taking that and back. And then try again. So you need to have a nice friction. Okay? You can do the base of the wrist. So again, look to see that you are actually above the spine right away. Yeah? Knuckles this way, knuckle the other way. Whenever I go deeper, what would be the relationship between that and the speed? Should I go faster?
Slower.
Slower. And if I go faster when I go deeper, what could happen?
Cause irritation.
It can cause irritation. It's too much. So you have to be very kind of careful with that. Okay? We can do also compression, but you know, compression is deep anyhow, so it's not much difference. But I just want to stretch what you think about deep tissue. It's not only forearm, it can be anywhere. Okay, now we're starting with the forearm technique. So just be sure to have their hand either close to their body or further away. And now, first thing, I want you to go and feel with the quads area, the table. So I'm actually almost leaning on the table. Yeah? And then I bring my hands, I bring my forearms onto the center of the erector spinae muscle. And then I put the other hand as a support and weight sort of here, but I'm not holding it strong. So this hand is very easy, and the other hand as well. So very relaxed. Then now, I don't start right away. I don't move right away, but all I need to do is just to find how I can lean slowly into it. And maybe it takes 10 counts to really slowly lean into it. And I'm looking to see that I'm above the spine, so my eyes are above the spine. Because if I'll be here, I guess Callum can see right away that actually I'm not there. There is no weight, yeah, to here. Okay. I'm not moving yet. Now I feel comfortable to start moving. So what is the little things that I need to do in order to move myself forward? I need to go a little bit backward and wait. And then it's actually allowed itself to move, but you can't feel it. You can't see it. I can feel it very, very slow. Do you feel the movement? So, you know the machine that lie the asphalt on the road? Yeah? It's heavy but very slow. That's how you need to do it, very slow. That's it. And then, for now, I'll come back backward and start again. So, start by organizing your body. Come close to the table. Put the hand, put the forearms, and then rest the other hand around the wrist. Relax them. Then the sensation is actually of you kind of getting drunk and just leaning down and then going a little bit backward, just a little bit backward, and wait. And then I want you to get the tissue slack that actually allow you to move forward. And then you need to move along with it. All right, I think if you do that well, it's 70% of what you need to learn in terms of deep tissue. How to actually put your weight, move a little bit, and allow the weight to move you. It's very easy. It's actually as easy as just dropping your weight. You should not do anything with this arm. Nothing happened with the arm. It's not gonna, you're not using any muscle, but your weight, really. Okay, shall we give it a try? Cool.